If you've been in Medicare for a couple of years or maybe longer, there may come a time where you need to change your Medicare supplement plan. And I'm going to show you there are a couple of different reasons you might want to do that. I'll show you when you can do it and kind of how you can do it. And this is where it gets a little different because some states have different rules. So I'm going to go through that all right now. I'm Keith Armbrecht, founder of Medicare on Video, and I help people in all 50 states make the right Medicare choices, and I can absolutely help you as well. One of the best parts about what I do, there's no cost to you to allow me to help. So hopefully you'll take advantage of everything that we do, and we'll make sure that you get the best value in your Medicare. So right now we're going to talk about changing a Medicare supplement plan. This can be a little confusing because Medicare supplements are what you have if you stay with original Medicare, Medicare Part A, Medicare Part B. They are not Medicare Advantage plans, and there are different rules. With Medicare Advantage, you can only make changes during Medicare open enrollment, which is at the end of each year. With a Medicare supplement plan, there's no time frame. So you can make a change or do whatever you want anytime during the year. And sometimes that confuses people on how exactly they can manage their Medicare plan. So I'm gonna go through it right now, show you what you can do and how you can do it. And again, a medigap plan is a Medicare supplement plan. That's exactly what it is, and it fills the gaps in Medicare Part A and Part B. And when you first come into Medicare and you sign up for Part B, so once your Part B starts, then you have an open window for 6 months to pick any Medicare supplement plan you want, and there's no questions asked. So you don't have any medical underwriting to qualify for any Medicare supplement plan that you may choose. So obviously you want to do that when you first come in. Now, once you're in for a couple of years, there can be rate increases on Medicare supplement plans. Most of the time, they're pretty standard, 2 to 3%, but sometimes they can get kind of crazy, and we need to reassess exactly what we have. So you do want to compare your Medicare supplement pricing every year because, again, with Medicare supplement plans, they're standardized. So a Plan G is a Plan G, a Plan N is a Plan N. Doesn't matter which insurance carrier we have. The only difference between carriers is the price of the plan. So we want to make sure we have the best value. So when we come into Medicare and we start Part B, we're going to have 6 months, pick anything you want, do anything you want, and you could even pick one and then change to another one, but that's obviously not something that makes a lot of sense. So after that 6 month period, so from month 7 on, there is medical underwriting in most states. So there are some states where there is not medical underwriting. I'm going to show you that in just a second as well. But so with medical underwriting, you need to qualify. So in other words, an insurance carrier could say no. So it's basically major stuff that would knock you out of qualification. So similar to applying for life insurance. So if you have had anything major in the last couple of years, then likely you may not qualify to be able to change a Medicare supplement plan. So we want to manage that as best we can. So they're going to ask health questions. They're going to want to know prescription drug history, and then whether there's been hospitalizations. Some are 2 years, some are 5 years, depends on what the exact scenario is and which carrier's questionnaire we're working on. So in other words, an insurance company at that point can say, yes, we're happy to have you, or no, we don't want anything to do with you. So we need to kind of keep that expectation in mind that we need to qualify. So if you are in good health and you have had an increase in your Medicare supplement plan, absolutely take the time to compare while you can change, but also understand that new plans come out at lower costs. So even if it's a different Plan G, sometimes they get more aggressive and they're looking for business. So it may be worthwhile, even if you haven't gotten rate increases, we might be able to find a lower price for the same coverage that you currently have as well. So keep that in mind as well. Let's talk about some state-specific enrollment rules. And again, I don't know why different states do different things, but they do. And generally the premium kind of reflects what they do. So the more rights you have in certain states, generally the higher the premium is going to be, because it gives you more control over the insurance carrier, which is good, but also may increase the cost. So here we have year-round open enrollment. So in New York, Massachusetts, Connecticut, You can do anything you want, anytime you want. There's never any health questions. So if you're on a plan and you want to go to a different plan, all you have to do is fill out the application. So there is absolutely no underwriting in these 3 states. Now, the requirement here, you don't even have to have a Medicare supplement plan to get into a Medicare supplement plan. So the difference being, if you do not currently have a plan, you're already in Medicare, and you want to go to another plan or a new plan, then they may have a pre-existing condition clause where they may X out 3 months or so if you have a pre-existing condition. Now, if you currently have a Medicare supplement plan, you want to go to a different Medicare supplement plan or upgrade your Medicare supplement plan, no underwriting, no pre-X, do whatever you want, makes it easy. Now, what you will find is in New York, Massachusetts, and Connecticut, Medicare supplements are more expensive than they are just about anywhere else in the country, because you are able to go from one plan to another without medical underwriting. So that's just one of the ways that insurance works. Now, in California and Oregon, they have what they call the birthday rule. And the birthday rule gives you the ability once a year to change plans. So you must already have a Medicare supplement plan, and 30 days before your birthday, 30 days after your birthday, in that window, if you want to change to another plan. So if you got a big rate increase, and that's what this is designed for, you can go to another carrier with a lower rate. So if you have a plan G and you got a big rate increase, this gives you the ability, and this is a pretty good rule, to get off of that rate increase and go to the same plan with a different insurance company. So, but it has to be done within that window of 30 days before, 30 days after your birthday. So keep that in mind, California and Oregon. So now, Missouri is the anniversary rule. So Missouri has an anniversary rule, which it makes it a little more complex because people don't necessarily know when their anniversary is, but guess what? You likely signed up right at your 65th birthday. So it's probably right about the same as your birthday rule. So it works the same as the California and Oregon birthday rule, but it works on the anniversary. So the anniversary of your Medicare policy, it's 30 days before, 30 days after. You can make a change, same as you do in California on your birthday. So the only difference is it's on the anniversary, which may also be your birthday. So let's hope that's the case. But just stuff you need to understand ahead of time so that you don't have to put a lot of investigation into it when the time comes. So different states here, Washington and Maine, kind of similar to New York, where you have year-round open enrollment, but you must have a current Medicare supplement plan. So if you have a current Medicare supplement plan, you can jump up, jump down, jump around, do anything you want without medical underwriting to another plan. In Maine, it has to be the same plan you have or less. So in other words, if you have a plan N, you could not upgrade to a plan G. If you have a plan G, you could go to another plan G, or you could go down to a plan N. So keep that in mind. In Maine, it throws in a little bit of caveat. And again, prices generally reflect the more freedom you have, the higher the cost. So that kind of gives you a pretty clear understanding of changing Medicare plans when you need to change it. And again, makes all the sense in the world to let's compare every year. So feel free to give me a call, send me an email. I have another website called MedicarePriceCheck.com where you can just fill in your information and we'll do the comparison for you. And if it makes sense to change, we'll walk you right through and make sure that we get it all done in the proper fashion. So I hope you found this helpful. If there's anything we can do, let us know. And I hope you have a fantastic day.